Chapter 7, Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 1. Listen to dialogue number 1. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple-choice questions at the end of the dialogue.
Good afternoon. I'm Chris Maloney, and I'm the pharmacist working with your doctor, Dr. Gary Lubin. Are you Amanda Adams?
Yes.
How are you today?
I'm okay, except for my esophagus and my reflux.
Yeah, I see from your chart that you've been having problems with GERD. Can you tell me a little bit about what's been going on and the medications you've been taking?
Well, about 3 months ago, I noticed I was having some heartburn, even though I wasn't eating any spicy foods, like Mexican and Thai food. So I took some Maalox, Mylanta, Tums, but those didn't work.
You got no relief?
Not only didn't I get relief, but I started to choke and gag on my food. One day about 2 weeks ago, it was pretty bad. My husband took me to the emergency room and they referred me to a gastroenterologist. And he gave me an endo something, to look down my esophagus.
You had an endoscopy. And what did the doctor find?
Well, he told me my esophagus was really inflamed and that I had a hiatal hernia and that was causing my choking and my problems swallowing. So he gave me medication. He gave me Zantac, and I told him if that's the generic, that's fine. I refuse to pay for brand names. He told me that Zantac was the brand name drug and that the generic is ranitidine. I think it's spelled Ranitidine. He told me it's in liquid form, so I don't have to swallow pills.
That's right. When did you have the endoscopy?
3 days ago, but I'm just getting my prescription now.
Okay. Are you still having problems swallowing and choking?
No, I haven't been eating much since my throat feels a little sore. I'm just eating Jell-O and soup and stuff like that, but I'm starting to feel better.
Good. What did the doctor tell you about ranitidine?
I really have no idea. I was drowsy and groggy after the endoscopy. I can't remember what he said. He spoke to my husband, but he can't really remember either. Can you tell me?
Absolutely. Well, like I said earlier, you have GERD. Ranitidine will help to reduce the stomach acid that is causing the problems. Dr. Lubin wants you to take a teaspoon in the morning and a teaspoon in the evening. You can take it with or without food. Try to take it at the same time every day. Are you taking any other medications?
Well, I did have pink eye about 2 weeks ago, and I was taking tobramycin, and it cleared up.
Okay, that's good. Do you have any questions about the ranitidine?
Yeah. Is it going to make me stop choking and having problems swallowing? It's pretty scary.
Well, it's going to help prevent too much stomach acid from producing. It will help to reduce the inflammation in your esophagus. But if you continue to have choking episodes, tell your doctor. I want you to be aware that this medication can cause dizziness, headaches, constipation, and diarrhea, though very unlikely. If you get a rash, have swelling, and have trouble breathing, call your doctor immediately.
Are you serious? When I was in college, I had a CAT scan and almost died. I stopped breathing, started convulsing, but they gave me Benadryl and I survived. I found out later I was allergic to iodine.
Wow. Yeah, I see from your chart that you're allergic to iodine. And another thing, avoid alcohol.
Don't worry. I don't drink. And Dr. Lubin told me because of my bad esophagus, I can't have alcohol.
That's right. Do you have any questions?
I'm starting to get a headache. Can I take my Tylenol when I get a headache while I'm on this medication?
Yeah, Tylenol is fine, but try to avoid ibuprofen and naproxen.
What are they again?
Motrin and Aleve.
Okay.
Chapter 7. Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 2. Listen to dialogue number 2. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple choice questions at the end of the dialogue.
Hi, are you Mr. Alex Hardy?
Yes, I am.
How are you today? My name is Jerry Wade, and I'm the pharmacist on duty in the clinic today. I'm here to talk to you about the medication Dr. Finkel has prescribed. He has prescribed Asacol. Do you know why you need to take Asacol?
Well, I have colitis. I've been having diarrhea and bleeding from my rectum. And sometimes I can't go to the bathroom, even though I feel like I have to go.
What you have is ulcerative colitis. That is causing inflammation in your rectum. That's why you are having a difficult time moving your bowels. Is this the first time you've experienced colitis?
Yes.
Okay, before I begin to explain how to use Asacol, I just want to confirm a few things in your patient chart and ask you a few questions.
Sure.
Is your birth date December 12, 1961?
Yes.
Your chart states that you're allergic to penicillin. Anything else?
No, I don't think so.
I also see that you have had problems with a fungal infection. Can you tell me more about that?
Well, I had these dry red patches on my arms and my legs near my groin area, like jock itch, and the doctor told me it was a fungal infection and gave me a pill that starts with an N. I don't remember the name.
According to your chart, it was Nizoral.
Yeah, that's it.
Are you still taking Nizoral?
No. My jock itch went away about 3 weeks after I started taking the medicine. That was about 2 weeks ago.
Okay, good. Now, let's talk about your medicine for your colitis. The doctor wants you to take 2 tablets 3 times a day. You don't need to eat food with it, but make sure you take the tablets whole and that you not chew or crush them. You should also know it's possible that you might see parts of the tablet or the whole tablet in your stool. If this happens, tell your doctor. Any questions so far?
Is it going to give me gas? When I started taking the medicine for my jock itch, I was having more gas than usual.
Well, it might. That's one of the possible side effects. You might also have flu-like symptoms and abdominal and back pain. I'll give you a complete list of all the possible side effects for you to take with you. But if you get very bad stomach and abdominal pain, worsening bloody diarrhea, or constipation or a fever, call your doctor. And try not to drink alcohol while on this medicine.
Not even a beer now and then?
I don't recommend it. Do you have any questions?
Yeah. What should I do if I forget to take it?
Well, if you miss a dose, try to take it as soon as you remember. But if you remember right as you're coming to your next dose, skip the dose you forgot. And don't double up to catch up.
Okay. I just hope this medicine cures whatever it is I have.
Well, Asacol is not going to cure your colitis. It's going to treat it. Asacol is an anti-inflammatory drug that will help to treat your condition. It will decrease some of the symptoms you're having, such as diarrhea and bleeding from your rectum. Of course, if you feel the medication is not alleviating your symptoms and not making you feel better, call your doctor.
Thanks. I will.
Chapter 7. Pharmacist-Patient Dialogues. Listening and Comprehension Exercises. Dialogue number 3. Listen to dialogue number 3. Stop, listen again, and take notes. Listen to the dialogue as many times as you need, or until you feel you have written sufficient notes and feel confident. You can use your notes to answer the multiple choice questions at the end of the dialogue.
Good afternoon. Are you Lily Soto?
Yep, that's me.
Hi, I'm Chaz Oliver, and I'm the pharmacist who's going to review your patient chart and go over your new prescription with you.
You mean my prescription for my constipation?
Yes.
You have no idea what I'm going through. It's terrible. Not being able to go. My stomach is all bloated. My pants don't fit. I feel pregnant. I'm really starting to tear my hair out. Have you ever been constipated?
I'm sure we've all been at one time or another.
Please help me. I can't take it anymore. I can't remember the last time I had a good bowel movement.
Okay, Lily, let me look over your chart. I see the last time you were in the clinic was about 4 weeks ago.
Yeah, I was here to get my blood pressure medication refilled. I'm taking a drug called Tell Me something.
Tell me Sartan.
That's it. I've been taking it for about 2 years, and I still don't know how to pronounce the name. High blood pressure runs in my family. Here's my prescription for my constipation.
It's a prescription for Dulcolax.
Is it a pill or a suppository?
It's a suppository that will help to stimulate your digestive tract and your intestines. Have you used suppositories before?
Yeah, when I had hemorrhoids.
Okay, so then you know how to insert them. I would advise that you try not to have a bowel movement 10 to 15 minutes before you insert the suppository.
Okay, I won't. How many do I use?
Insert one suppository before bedtime or in the morning before breakfast.
Will it work fast?
Well, you may feel it start to work after about 30 minutes.
How long should I use it?
Your doctor has ordered a box of 6 suppositories. You shouldn't use them for more than a week. If you don't have a bowel movement after taking the suppositories, see your doctor.
I can still take my blood pressure medicine, right?
Sure.
Are there any side effects with these suppositories?
You might experience some irritation in your rectal area, and you might experience cramping and diarrhea. But if you experience bleeding, or like I said earlier, you have no bowel movement, contact your doctor immediately.
Okay, I will. Thanks. Hopefully I'll start feeling better.
Chapter 7. Post-Assessment. Dialogue number 1.
Hi, are you the pharmacist?
Yes, I am. How can I help you?
Well, I'm a little bit embarrassed, but I need something to help me with my constipation.
Sure. Do you have a prescription from your doctor?
No. Do I need one?
No. We have many over-the-counter treatments that can help you. How long have you been constipated?
Well, almost 3 weeks now. I'm having difficulty going, moving my bowels. I strain, but nothing happens. In fact, I think I also have a hemorrhoid from all the straining.
Do you have any allergies?
Not to medicines, but I'm allergic to milk and onions.
Are you currently on any medications?
I take birth control pills.
Okay. Come with me and I'll show you some products that you can choose from. But I would suggest SaniSup. It's a glycerin suppository that you insert into your rectum. Make sure you moisten the suppository with lukewarm water before inserting. The instructions are on the back of the box.
Okay. This is so embarrassing. I've had suppositories before. After I had my first child, I had so many hemorrhoids from pushing so hard during labor, my doctor gave me suppositories to get rid of my hemorrhoids.
Good, so it shouldn't be difficult. Use the suppositories as needed, but try not to use the suppositories for longer than a week. If you're still constipated, I recommend that you see your doctor.
Is there anything else you can recommend? Being constipated is so uncomfortable and I feel so bloated.
Well, first make sure you drink plenty of water every day. 4 to 6 glasses is good. Eat a lot of fiber and roughage. I can also recommend Metamucil or Citracel.
What's the difference?
No difference, really. They are both fiber laxatives, which help to increase the amount of water in your stool and to soften your stool. Both come in powder, chewable tablets, and wafers. But you need to drink plenty of water with all of them. And make sure you read the label carefully.
Will it help me with my hemorrhoid?
It should. Metamucil is also used to treat hemorrhoids. But if you want a topical ointment, you can use preparation H.
Yeah, I've used that in the past. I'll get that too. How long should I take the Metamucil?
No more than 7 days. If you're still constipated, please tell your doctor. Do you have everything you need?
Yes, I think so. I have the Sanicept suppositories, the Metamucil chewable tablets, and preparation H, and hopefully the end of my constipation. And thank you so much. You've been very patient and helpful.
My pleasure. Here, I'll take those to the register where you can pay for them.
Chapter 7, Post-Assessment. Dialogue number 2.
Good morning. Are you Samuel Torres?
Yeah, that's me.
I'm Erin Farrell, and I'm the pharmacist who will go over your prescription to treat your peptic ulcer and answer any questions you might have. How are you today?
I've been better. This ulcer is really bad news.
Can you tell me more about the discomfort and pain that you're having?
Like I told my doctor, I'm still having a pain that burns. You know, a burning pain around my belly button, my breastbone.
Does the pain last a long time?
It comes and goes, you know. Sometimes it's just for a little while, and sometimes I can have pain for hours. And it really flares up at night, so I have a hard time sleeping.
Before you saw your doctor, were you taking anything for it?
I took Maalox and Mylanta and Pepto-Bismol, and nothing would happen. I wouldn't feel better, so I stopped taking them and I went to the doctor.
Are you taking any other medications?
Just my vitamins, that's it.
Okay. Do you know what your doctor prescribed?
No, I don't remember.
Okay. I just need to confirm one thing. Are you allergic to penicillin or any kind of antibiotic?
No.
Okay. According to your chart, Dr. B.J. Lewis has prescribed Prevpac. It's used to treat ulcers caused by a bacterial infection. Prevpac contains medication to help block the acid in your stomach and also contains antibiotics to help stop bacteria from growing.
That sounds good. How long do I take it?
You need to take 1 tablet in the morning and 1 tablet in the evening, and you're going to do this for 14 days. Do not stop taking it before then, even if you feel better. If you stop taking it before the 14 days, you risk the chance of letting the bacteria continue to grow, and then you'll have the problem all over again, and you don't want that.
Yeah, you're right. Do I need to take it with food?
No, but take it before you eat. And make sure you swallow the tablets whole. Don't chew or crush them. Do you have any questions?
No.
Okay. You shouldn't experience any side effects other than maybe a headache and maybe a taste in your mouth you wouldn't normally have. However, if you have bad stomach pain, cramps, and persistent diarrhea, let your doctor know. And one more thing. It's important not to drink alcohol when taking Prevpac. It can make you dizzy or drowsy. Please read all the information regarding the side effects.
Well, I hope this medicine does the trick. I don't want to get another ulcer.
Well, there are things you can do to take care of yourself. I'm sure your doctor mentioned that smoking can increase stomach acid, and that excessive drinking can also irritate the lining of your stomach and possibly cause bleeding. And it's a good idea to avoid taking pain relievers such as Motrin and Aleve. If you need to take a pain reliever, take Tylenol.
Well, I am trying to quit smoking, and I'm not a big drinker, but I'll watch myself. You have some good advice.
Okay, then. If you have problems with the medication, call your doctor.
AVN Pharma Education.